They find a foramen here, and I don't know, like many people, they love to jump into some hole. So these fibers will jump into this hole, right? These are parasympathetic fibers from geniculate ganglion. They are eventually going to be lacrimal gland connection. So they jump from geniculate ganglion and they go to the middle cranial fossa. From there they jump into which foramen? Foramen ovale, no my friend. Foramen ovale is for mandibular nerve. Don't try to give me a little twist. This is like a lacerated foramen. Foramen lacerum. Okay, I know you don't know these lacerated things anyway. So this nerve jump into foramen lacerum. In the front of the foramen lacerum, right, it finds a hole. In the front of the wall of the foramen lacerum, it finds a hole, right, and these fibers love to enter into another hole, right? But there is one thing, one friend will join them. You must be knowing there is something called internal carotid artery, and around the internal carotid artery there is a plexus of sympathetic fibers. You know that? Some of the sympathetic fibers from here also come and join these parasympathetic fibers. Are you understanding what has happened? That parasympathetic fibers are coming from geniculate ganglion, right? From there they jump into middle cranial fossa, they jump into foramen lacerum and enter into this special canal. But before entering, they are joined by, these parasympathetic fibers are joined by sympathetic fiber which are coming from plexus around internal carotid. Is that right? Then these two fibers together move through this canal, they move through this canal and come into which foramen? Which area? My friend, I told you in the beginning of the lecture, Pterygopalatine fossa. And in this Pterygopalatine fossa, there is a ganglion here, right? And this ganglion is which ganglion? Yeah. What is this ganglion? Pterygopalatine ganglion. So these fibers, these parasympathetic fibers end up into this ganglion. And from here, post-ganglionic fiber will start. And sympathetic fibers just pass through this ganglion, right? Now let me tell you what are these nerves. Now please be attentive for a while. What are these important connections? Parasympathetic fibers, lacrimatory fiber from superior salivary nucleus or lacrimatory nucleus from lower part of the pons as a part of nervus intermedius, which is a part of facial nerve. They enter into internal auditory meatus and eventually reach up to geniculate ganglion. They are lacrimatory fibers, depart separate from the salivatory fibers. Lacrimatory fiber move from geniculate ganglion, making a very special nerve which bothers the medical students a lot. Because all of you have heard of this nerve, but I know you will not tell me the name of this nerve. From this nerve, they will jump and reach up to here. But someone may tell me, what is this nerve called? This branch of facial nerve. From geniculate ganglion, having parasympathetic fiber mainly, few sensory fiber, and going to middle cranial fossa, jumping into foramen lacerum. What is this nerve? You have heard of it. It is called greater petrosal nerve. Have you heard of greater petrosal nerve? Oh my God, you have not heard so many things. So this is greater petrosal nerve. Is that right? And from sympathetic plexus around the internal carotid artery, sympathetic fiber jump and they also become fused with the greater petrosal nerve. Now, these sympathetic fibers which are jumping from the internal carotid artery towards the greater petrosal nerve, this branch, what is this called? Yes, you are right. Deep petrosal nerve. What is it? Deep petrosal nerve. So greater petrosal nerve and deep petrosal nerve, they come together and they move through this canal. This canal which is moving from the anterior wall of foramen lacerum up to which fossa? Pterygopalatine fossa, this bony canal is called pterygoid canal. What is it called? Pterygoid canal. And this nerve, which is now made by the greater petrosal nerve and deep petrosal nerve, and both of them together move and reach connected to the ganglion, this combined nerve is called nerve to pterygoid canal. What is it called? Nerve to pterygoid canal. Another name for this nerve from here up to here, another name for this nerve is Vidian nerve. What is this? Vidian nerve. Vidian nerve or nerve to pterygoid canal. So in this way, sympathetic fibers from the facial nerve, right, they have reached to pterygopalatine ganglion. Now, you know that your friend, what is this here? Lacrimal gland, you know? Lacrimal gland is here. So, preganglionic fiber end here, from here this postganglionic fibers have to somehow reach to, what is this? Lacrimal gland. And how they reach there? Right. Before I really move forward, I want to tell you now, this was anterior cranial fossa. What is this? Middle cranial fossa, right? From middle cranial fossa, let's come another area. There is a very big ganglion here. What is this ganglion called? Trigeminal ganglion. You heard of trigeminal ganglion? Which has one ophthalmic division, other maxillary division, and another mandibular division. You must be knowing ophthalmic division, fibers enter through superior orbital fissure and they divide into nasociliary branch, and they also divide into frontal branch, they also divide into, okay, what is this nerve? Ophthalmic division. Ophthalmic division divide into three branches. One is nasociliary, other is frontal, and another is lacrimal. And this lacrimal branch comes here, right, to the lacrimal gland. Okay, I remove this. You know that it's there. Now, if these parasympathetic fiber have to reach to the lacrimal gland, somehow they should reach to lacrimal, communicate to the lacrimal nerve. How they do? Actually, here is another foramen. It is very much a round foramen. What we call it? Foramen rotundum. And from here, what is coming down? Yes, and forward. What is this? This was ophthalmic division. What is this? Maxillary division. What is this? Mandibular, right? Now, this maxillary nerve, it is passing from here, and you know. Now, actually, these parasympathetic fibers from pterygopalatine ganglion jump to maxillary nerve, right? Maxillary nerve give here through the inferior orbital fissure. Maxillary nerve give a branch which is called zygomatic branch, right, of maxillary nerve. These knotty fibers, they jump from the ganglion to the maxillary nerve and then move with which branch? Zygomatic branch. Is that right? This is zygomatic branch of maxillary nerve. From here, they make a communication to what? Lacrimal nerve. And with that, they reach to where? Lacrimal gland. So this is lacrimatory pathway of parasympathetic fibers. Let me recap, right? Start from the beginning. When a girl is weeping, right? What is the connection started? I'm talking about in central nervous system. Yes. Or a baby is weeping, right? Which nucleus is firing? Superior salivary nucleus, which is also called lacrimatory nucleus. Now you will tell me what are the fibers. Superior salivary nucleus, these are sympathetic, parasympathetic fibers. Parasympathetic, these are preganglionic, postganglionic. Preganglionic, because ganglion is there. These preganglionic fibers are part of facial nerve proper or nervous intermediate? Nervous intermediate. They are passing through which canal now? Internal auditory meatus. They reach to which ganglion? Geniculate ganglion. They don't synapse there. They are lacrimatory fibers separate from salivatory fibers. These lacrimatory fiber from the geniculate ganglion, this fiber exit and move towards the middle cranial fossa as greater, yes. Say it loudly, I don't hear. Which nerve? Greater petrosal nerve. Greater petrosal nerve jump into foramen lacerum. There it receive which nerve? Deep petrosal nerve. Together they make which nerve? Nerve to pterygate canal. And that reaches to Pterygopalatine ganglion. From there, preganglionic fiber end. Postganglionic fibers from here, mainly they jump to the maxillary nerve, the zygomatic branch, and then communication of zygomatic branch to lacrimal branch, and with that this fiber reach to lacrimal gland. This is the minimum you should know about this pathway, lacrimatory. But of course, all these parasympathetic fibers which are coming through the up to this point, of course, many of them are going to lacrimal gland, but some of them go to nose also, so nasal gland. Some of them come down and palatine glands. Some of them fibers from here go to paranasal sinuses like sphenoid sinus or frontal sinus or maxillary sinus, right? So a good doctor will remember that from Pterygopalatine ganglion, postganglionic parasympathetic fiber go for lacrimation. But excellent doctor will remember these parasympathetic fiber not only go to the lacrimal gland, but from here through other branches of Pterygopalatine ganglion, they go to the nasal glands, they go to paranasal sinuses glands, they also go to the palatine and palatine glands. Am I clear? Any question? No, thank God. So these parasympathetic fibers are done with lacrimatory pathway. Let's deal with the, what are these fibers? Salivatory pathway, right? Now, if we talk about the salivatory pathway, these parasympathetic fibers are coming with the facial nerve proper, they are moving through the facial canal backward, then these fibers go downward. They are moving with this. But when you look here, they don't come out from here, where they have gone. Listen carefully. These parasympathetic fibers, which are going for salivation and stimulate what? Sublingual and submandibular gland, from the geniculate ganglion, these salivatory fibers, you get it? They move with the facial nerve proper into facial canal. First they move in the horizontal component of facial canal, they move backward, and then in the posterior wall of the middle ear, in the facial canal, they move downward. But if you look at stylomastoid foramen, they never exit from here, where they have gone. Yes ma'am, where they have gone? Some magic has been done there. Anyone? Where these fibers have gone? Parasympathetic. They don't come, they do enter into facial canal, but they don't come out at the stylomastoid foramen. Somewhere on the way they disappear. They jump. Where they jump? They jump into middle ear. Right? The problem is that they were very happily going with that, but suddenly they realize if they keep on going, they will end up on the face. And glands are not on the face. Glands are inside. So as soon as they realize they are with the wrong partner and going for the wrong destination, they have to jump off the track and take a new road. Now, where they have to go? They have to go sublingual gland. What is this gland here? Sublingual gland. And what is this gland here? Submandibular gland. Now these parasympathetic fibers need to go to sublingual gland and submandibular gland. Now they have to somehow jump from the track and reach to some nerve which is going near to the tongue. Are you understanding? The nerve which go to the tongue, one of the very important nerve is lingual nerve. Is it difficult to remember that lingual nerve goes to the tongue? It's easy. It means these fiber, parasympathetic fiber, somehow should jump from the seventh nerve and go to which nerve? Say loudly, my friends. They have to jump to which nerve? Lingual nerve. Now we see from where is the lingual nerve? A little bit whereabouts of lingual nerve. You must be knowing there is something called foramen ovale here. One of you was trying to push some other nerves there. You know, foramen ovale here. Through foramen ovale, this is the mandibular division which comes. You understand it? Mandibular division. One of the branch of mandibular division divided into anterior division and posterior division. I will not go into detail. One of the branch of mandibular division is called lingual nerve. And this lingual nerve goes to the tongue and give touch, pain and temperature from the anterior 2/3 of the tongue. Lingual nerve collect which sensation from anterior 2/3 of the tongue? Touch. If someone touch your, where is the tip, boy? Yes, if someone touch the tongue, anterior 2/3 of the tongue, right? So which nerve is going to take fibers of the touch? Yes? Lingual nerve. It takes touch, and if someone bite there, again it will take pain, touch pain, and if put a hot potato in your mouth, again this. So lingual nerve take the fiber of touch, pain and temperature. But if someone has in his mouth, hello, in mouth chocolate also, so then anterior 2/3 of the tongue has to taste the chocolate, right? Taste is not done by this component of lingual nerve because this is coming from trigeminal system. Trigeminal system is concerned with somatic sensation, which are touch, pain and temperature. Now you remember that this salivatory, okay, so these fibers were passing through internal auditory meatus, geniculate ganglion, facial canal. Suddenly when they were going down in the facial canal, they realized, oh my God, I'm going to go out of the cranial on the surface of face. So they decide to jump off from here. From here they should jump off. I think here their brain worked. Here the fibers suddenly realize that they are going for wrong destination if they follow the facial nerve proper. So now where they have to jump? Yes, my friends, to lingual nerve. Now how they have to jump? They are on the posterior wall of, they are inside a bony canal which is present in the posterior wall of middle ear. So first they have to make a hole and jump out of this canal. So actually this canal has a hole here. This canal has a hole here. This is called posterior canaliculus, right? From this canaliculus, these parasympathetic fibers move and jump into where? Jump into which cavity? Yes, my friends. Middle ear. From here, now they have to move backward or forward for lingual nerve? Forward. They jump through that like this, right? While they are jumping like this, then from here, there is a special fissure. We call this fissure pterygotympanic fissure. What we call it? Pterygotympanic fissure. From there, they jump out. And as they jump out, they see their friends going. What is this nerve going? Lingual nerve. This is an infratemporal fossa. So in the infratemporal fossa, these parasympathetic fibers will jump to, what is this? Lingual nerve. They will go with the lingual nerve, they will go with the lingual nerve, but again, they don't want to go to the tongue. They just find here, what is this ganglion? Submandibular ganglion. They separate from the lingual nerve, and preganglionic fibers end up into which ganglion? Submandibular ganglion. From here, postganglionic fibers go to, what is this? Sublingual gland, and also go to submandibular gland. So salivation. Am I clear? So we have dealt with the final destination of these branchiomotor fibers. We have also dealt with the fibers in the facial nerve coming from superior salivatory nucleus, which are lacrimatory fibers and salivatory fiber. Now we are connected with what is this dancing nucleus? Nucleus of tractus solitarius. Is that right? Now, nucleus of tractus solitarius, I told you, facial nerve bring the taste fiber from anterior 2/3 of the tongue, and they are connected with nucleus tractus solitarius. So what really happened? Now, touch, pain and temperature from anterior 2/3 of the tongue is taken by lingual nerve. But this is the taste fiber from anterior 2/3 of the tongue, right? They are also going with the lingual nerve. These are taste fiber. And these are touch, pain, temperature, hot potato here, but chocolate here. Is that right? Taste fibers go from here. They are going as a part of what? What? Lingual nerve. Here it was lingual nerve. Now, these are which fibers? Yes, please. Taste fibers are part of the lingual nerve right now, and they leave the lingual nerve because they don't want to end up into trigeminal system. They have to end up into tractus solitarius nucleus. So they move with the parasympathetic fibers. From here they jump into, what is this cavity? Middle ear cavity, right? From here they enter where? Posterior canal, and from here they go upward. Taste fibers. What are these fibers? Taste fibers, and yes, they are connected to the tractus solitarius. Right? Now, so it means that salivatory pathway fibers, parasympathetic fiber for salivatory pathway, and what is this? Taste fibers, they have little common thing. That taste fibers, actually they are sensory fiber, they should be explained from periphery to the center. But I will do it from center to periphery just to make it easy to your mind. So fibers are where? Tractus solitarius. Here are which fiber connected? Gustatory, taste, sensory fiber. These fibers move with the parasympathetic fiber into which facial nerve proper or nervus intermedius? Nervus intermedius. Taste fibers go through again with the facial nerve into internal auditory meatus. Taste fibers are passing through geniculate ganglion. Now this is the point to remember. Actually, geniculate ganglion has the cell bodies of these taste fiber. Geniculate ganglion has cell bodies of these taste fibers, and from these cell bodies, peripheral process go to the tongue and central process go to the nucleus tractus solitarius. In the geniculate ganglion, there are cell bodies of taste fiber, and later on I will tell you some cell bodies of touch, pain, temperature fiber from here. Touch, pain and temperature fibers from here, right? Now, so geniculate ganglion is not a parasympathetic ganglion. Geniculate ganglion is a ganglion which has cell bodies of sensory neuron related with the taste from interior 2/3 of the tongue, and also cell bodies